cloud. Good afternoon, my magnificent ones. Sue Paulson here, your magnificence mentor, and we're back with another episode of the Healing Call of Cancer. Today is a really special day because I have a guest. My guest today is Dr. Francisco Valenzuela, who is a psycho-oncologist and a dear friend. We've known one another since I first started working with Francisco when I was going through cancer and beyond. And he agreed to just come and have a conversation with us today about what he knows about the treatment of cancer from an emotional, mental, spiritual perspective. So I'm not going to do a thorough introduction of Francisco because I think who he is will emerge as we go. The one thing I do want to say, though, is he has published a great book, which I'm going to put the title of in the description underneath the video so that you can access it if you want to. So this is his beautiful book. It's called Psycho-Oncology, Hypnosis and Psychosomatic Healing in Cancer. So it's a great read and filled with a number of case studies of people that Francisco has worked with over the years to make his research into cancer just come even more alive. So welcome, Francisco. It's a delight to have you here today.
Well, it's nice seeing you again, because in the long term, we became collaborators in this journey called cancer healing.
Absolutely, absolutely. It's been quite the ride along the way, hasn't it? So the first question that I wanted you to talk about was what drew you to psycho-oncology? What drew you to this field? Because you started out as a professor in Chile in social work, did you not?
Yes. Actually, that I believe is part of the reason why I ended up as a psycho-oncologist, even though at that time it didn't even know it existed.
Sure.
Probably you are one of the few people that knows that I arrived to this country as a political refugee. After being expelled from my position as a professor of the University of Chile in Chile and spent sometimes in prison and concentration camps and torture chambers, which is the place in where I learned about pain. And in this way, I feel a certain connection with Viktor Frankl, which happened, I went through the same experience on a different setting.
Sure.
So then in arriving into Canada and starting again from learning the language to living a different reality in a different culture, and then being hit by the reality that after going through so much thing with my wife finally was diagnosed in 1985 with cancer, which is connected with, actually, in my opinion, what happened in Chile. For her, waiting news from the husband that she didn't know it was alive or dead, and her being stranded in a different country like Peru, and then finally being rescued and sent to Canada. Of course, all these crises at the end had to create something, and this something was cancer. So there is a strong connection between crisis and cancer. I still don't know in my experience. Somebody has said, I was very happy and everything was perfect, and suddenly I got cancer. It just doesn't happen. So while working with Matilda, I realized how little knowledge I had, how little knowledge we had of cancer. She was diagnosed in 1995 with insuductal carcinoma. And that was Chinese for us because we didn't know what it was.
No.
We didn't know how it came. The only thing we knew is that through suffering, something happened, something happened, something terrible happened, and that was cancer.
Sure.
And that determined in my side that I didn't know enough, but I wanted to become part of the team that was working with her. So I went back to school. I study, I work. But at the same time, she was well enough to recover, and then keep on going on her practice of psychology because she was a psychologist.
Sure.
So both working on that field, we learn many things, including how a psychologist react with a sickness that has a high percentage of emotion, high percent of a psychological load. So that is the reason why, little by little, and without even knowing, I ended up being a psycho-oncologist.
Well, that's amazing. Well, I'm grateful that you did, because when I came on board as your client in 2013, I think it was, late 2012, early 2013, it was a lifeline for me. And so I'm grateful that the experience eventually led you and I together so that I could do the healing that I needed to do. So tell me then, Francisco, you made a very clear distinction at the beginning of our session between the patient and the client. Can you talk a little bit about that?
Well, I don't like much the concept of patient because it means a recipient of services. I rather like the concept of client, which is a member of the team. The client and I, we are working from different positions into one common problem. And therefore, we are both healers. And that is probably the main distinction between patient and client. A patient comes and expects to be a passive recipient of a service, whereas a client is a full person participating in the process because she is a mind body that have to heal. And so that makes us equal at the same level, no higher or lower, which is different than what it happened when you go into a medical system or a medical service in where you are the patient, you are the person receiving all sorts of a treatment, and nobody explaining you anything. You just sitting in there, receiving or being the subject of something you don't understand. That, in my opinion, is not treatment.
So you see it as very much a cooperative connection between you and your client, that you're working together. And do you bring in other members of the family if it's appropriate, or how does that work?
Sometimes, yes, we do. And that depends on the level of comfort, of the client. Okay. Because sometimes, cancer really is not the sickness of one person. cancer is a family affair, and therefore everybody should participate in the healing process, because the treatment doesn't happen in the office. Treatment goes through the whole day and the whole night, and in every place in where the client is interacting with somebody or is even alone.
Mm-hmm. Oh, that makes sense. So when you work with a client, Francisco, what is your main goal in helping them?
Well, if we compare, sorry, if we compare a typical treatment place like a cancer institute or the office of a physician, the office of an oncologist, you will see that this person is just somebody, is an organ, is a diagnostic, is a person carrying a label. That's all it is. But the concept of person is not addressed by the practitioner.
Mm-hmm.
Therefore, my main role is to make sure that this person is treated like a person, and I have to recognize that she has a story to tell, a series of experiences to tell that will allow me to have a clear idea of where all these crises come from. And therefore, I don't zero in the sickness, I don't zero in the label. I zero in the person suffering a crisis. I identify the crisis and I start working toward the solution of this crisis. And believe it or not, when you solve the crisis, you solve the sickness. I've seen it many times.
Sure, sure. And so you have some particular methodologies that you use in working with your clients, Francisco. Did you want to talk a little bit about that?
Sure. Sure. Well, my first approach is sitting and listening to a story. Is staying there for the client to tell me anything that is a load on him. One of the benefit I had in all of this is at one point being able to go to the mind-body medicine program at Harvard Medical School. And then there is in there the idea that there is not a sickness per se, but the allostatic load, as they call it, which is all the weight that the person is carrying, the emotional weight. And then when we settle into this weight, then we will start discovering in which way this weight of negative happenings are creating reactions at the body and organ level. So then working in the allostatic load is my first approach. And in order to do that, I have to learn from the client the whole story. And every story is different. And in some cases, the story is sometimes created more by the physician than the client itself.
Oh, interesting.
Yeah.
Why do you say that?
Well, I'll tell the story of I will call it my friend Ivan. My friend Ivan came one day about 4 years ago and saying, Francisco, by the way, my client, don't call me Dr. Valenzuela, because since we are part of the team, I am Francisco and he is Ivan. And I don't see any reason why it should be different, because both we are persons.
Sure.
So then he says, I'm just coming from the office of the oncologist And he said that I wanted to go through an examination of my prostate. And he says that I have some points in the prostate, some kind of indication that there is cancer in it and is elongated, and therefore he has to operate on it, and he has to then take it off, put a catheter in it, and then I will be carrying a bag for about 6 months I won't be able to work. And and I say, how did you know? Well, he discovered it. How he discovered it? I went through a routine examination. And when you went that routine examination, Ivan, were you suffering from something? Not really. So do you have any pain? No. So do you have any indication from your body that is telling you that you have a prostate that is enlarged? Really no. Who sees a prostate? I cannot. And probably neither is the doctor, but they have ways to find out. So then, what would you like to do? I don't know, because I am going to be going into surgery. They will take the prostate off, and they are going to irradiate the lower part of my abdomen. They will burn my kidneys and my liver, and then I will have a connection that will get all the urine into something that I will have on the leg. And they said that I will be not able to do any activity, including sex. And so this is the reason why I'm here. I say, well, I thank you for the trust. But to tell the truth, I don't see any kind of expression of a sickness here other than your fear.
Mm-hmm.
And all the stress that is generated. Why don't you ask your physician for some basic questions? For example, is this treatment going to solve the problem?
Mm-hmm.
First of all. Second, that do you have a secondary option, meaning like a plan B for this treatment? What are the risk and the benefit of the plan A? What are the risk and benefit of the plan B? And the third one, what are the risk and benefit of doing nothing? Because so far you look to me pretty healthy and you are working. It's nothing that indicates that you have to get permission from your physician to not to work.
Mm-hmm.
So he went into the physician and came back 1 week later and said, telling me that the physician expelled him out of his office and that he said that he was not going to treat him and he has to look for a different oncologist. And that was it. Well, I said, then go back to work and go resume your life as if you were never seeing this physician, because obviously he doesn't need you and you don't need him. So a year ago, no, about 6 months ago, we got together for coffee and he says, do you realize that if I would have gone to that physician today, I would have been probably dead, or I would have been unable to work. I would have been with a bag in my leg still, no prostate, and therefore totally inhabilitated to do anything. And so far, I am exactly the same as when I went to this physician for consultation. So I took a decision, since I will never go into an examination again unless I truly need it. So in this case, my question is, Was a sickness present? I don't know. Was a person sick? I don't think it was. 3, was a system prepared to do all sorts of maneuvering for some strange reason on an individual without even thinking on what were the consequences? And the last one, he never received information regarding the questions he was asking.
Wow. Wow.
So when you face this type of thing, what did I do? I did absolutely nothing other than empowering the client with the belief that he had the right to ask questions. And he was in no way subjected to the whim of a professional.
Right. Well, and that seems to be one of the most important things, I think, when people get a diagnosis is, let's face it, we go in there and we don't know what we don't know. And the only way we're going to find out is to ask some very important questions. And the challenge that I find, certainly in my case, is I didn't even know what questions to ask. I had a few questions, but that question that you just mentioned about what are the risks and what are the benefits, that's a huge question that I'm not sure that I was prepared to ask. And I don't know if they're prepared to answer it on the other end either, because they don't really want to talk about, it seems that they don't really want to talk about the repercussions. Like what are you going to face when you go through this treatment? And in lots of cases, as we know, the treatments can be horrific for people, and you need to be somewhat prepared. So fear is a big factor then, Francisco. I think we agree on that fear is a huge, how does that play a role in the whole treatment and the move towards healing from cancer?
Well, actually, fear has many aspects, especially in cancer, because fear is created by the first word that the physician tell the person. The word cancer, it has such a negative connotation.
Yes.
Because cancer is equivalent to death. And curiously, it shouldn't be.
No.
Because cancer is something even occurring in normal individuals. All of us, we have cancer cells that are being eliminated by the immune system on a permanent basis, on a daily basis. Therefore, it doesn't have to be something that is creating the fear that we have seen in any one of the clients we have been working. As a matter of fact, sometimes you work on the fear, you empower the patients, and then they take care of their own cancer. And I don't have to go any further than your own situation in where I don't even remember what we did. Because at that time we just talk and we talk and we talk and we talk. And you did have the space to talk about everything. It was a space that was belonged to you. And then you took a decision, but you did something that is a characteristic of every one of the successful clients of mine. You didn't finish your cancer treatment. You received most of it, but then you decided to take a decision of controlling what you were going to do with your cancer. Yes. I understand that actually you did something that is more on the integrative side than the allopathic side, which is the typical things that are provided by the cancer institutes. So, but that part belonged to you. And so maybe you will be able to use it on a different on a different conversation, but it's just to remind me that in my office, every person that finished the treatment, and I have to say that include my wife and my daughter, everyone that finished the treatment didn't survive the treatment. Every one of them that stopped the treatment and went somewhere else, or simply didn't do anything, survived. And I have cases in my book that talk about it. One of them is my brother-in-law, which in 1965, when I was going to School of Social Work in Chile, social workers work in communities, sometimes communities where there is no hospital, no physician, no medical office, not even a pharmacy.
Sure.
They just really, they just do everything based on what they have in the community. And we are prepared for something like a little bit of public health to discover basic sicknesses that might spread all over the community. And sometimes maneuver like being able to work with a person having a baby and delivering babies.
Oh, wow.
Actually, in my time, I had the opportunity to deliver about 9 babies.
Wow.
Each one of them, each one was scared. Let's see, I was scared to do it, but I had to do it. So, anyways, my brother-in-law at that time, when they arrived home and signaled me to approach and says, you know, I noticed one thing, and is getting kind of a little bit uncomfortable. And I want, since you are studying these general things and you have seen all sorts of things at the hospital in your practice, and maybe you can give me an idea. And then pull his pants down, and I see his testicles swollen.
Oh, dear.
And at that time, being as young, irreflexive, and having not much knowledge, I use a little knowledge that I have. It looked pretty good to me, but I should have never. Well, it was wrong on my side, and said, well, Alberto, you have seminoma here. This is cancer, testicular cancer. We went the same night to the University Hospital in Concepcion, and he was operated on and his testicles being taken off. And then he started dying. He went home, went to bed, and started calling his brother and his sister. After several days, finally the brother arrived. And he said to him, you know what? I don't have the time to talk with you. I don't have the patience. I don't have a way to know what to do with somebody that is dying. So if you need some money, tell me how much, but I cannot give you my time or my compassion because I don't know how to do it. So, of course, my brother-in-law was furious. And he says, first of all, I don't need your time, your money, or your compassion. Second, I am not sick. I don't need you. You can go. I am not going to repeat the expletive.
Yeah.
And then next day, he came out of bed, went back to work.
Wow.
today, in what year is this?
2022.
Okay, he's still alive.
That was
He
1965.
is very old, and he just became a widower because my sister died 2 months ago.
Right.
But again, this is a time in where a person's reaction, his rage and his beliefs took over, and therefore determined that he was not sick. That were there, therefore he didn't need any attention, he didn't need any radiation, he didn't need anything, and he was pretty much on his own.
Yes.
And it worked because his attitude empowered his immune system, and his immune system solved the problem.
Mm-hmm.
And this is not the only case in where the only case I've seen. There are several cases in where the person did exactly the same, using just a belief, a conviction that he was in charge, and that was no other, no way about it. He was in charge, or she was in charge. And one of them was Matilda, because she was in charge in 1985.
Mm-hmm.
And when she decided to go into treatment just to solve a swollen arm, that was the time in where she became a patient, and the treatment created another cancer, and she died as a result of that cancer.
Sure.
And which is, I have researched, but this is another story because I am writing a book about it, about the lack of responsibility of some physicians that are being using the body of their patients for experimentation. The second thing is that demonstrate to me that medicine is not a science. Medicine is an art.
Mm-hmm.
And as such, it uses personal beliefs and personal emotions to take decisions regarding the creation of a diagnostic. If you go to 5 different physicians, you will receive 5 different diagnostic and 5 different opinions.
Sure.
And this is what they call evidence-based medicine, which in my opinion is absolutely no evidence of it.
Sure. So we've come a certain ways in understanding beginning to understand, I guess I would say, the mind-body connection. And yet it seems as if in lots of cases medically, there's no regard for that mind-body connection, that there isn't the understanding that our bodies aren't like cars where you, take parts out and replace parts or whatever. There's more to it than that. And certainly that's been my experience, is that there was way more to my story than the physical fact that cancer had grabbed hold of a small part of my body. And unraveling that made a huge difference in me being able to come through the other side and say, all right, I've been cancer-free for, oh golly, 11 years since the original diagnosis, I guess. And I've never really looked back. So when you think of people who get a cancer diagnosis, what can you give me, let's say 3 things to kind of wrap up our talk today, 3 things that you would recommend that they pay close attention to in as they go on this journey?
Yes, yeah. When you were mentioning that in a conversation, I started thinking and taking some notes. The first thing that I do is I talk with the person and I acknowledge that she has within her body the possibilities of creating the cancer in the same way of the possibility of reversing the cancer, because it's practically the same uh, the same process. There is a psychological stress at the base of everything. The person react with depression, with anxiety, with despair. That involve the limbic system that is going to react in a negative way, connecting with the hypothalamic system, and then the pituitary system, and then these systems are going to influence the immune system, and the immune system is going to paralyze all the possibilities of you to heal. And as a result, because of a crisis, your whole body react, generating an opening for all these normally faulty cells to gain terrain and to be free to reproduce and not being attacked and individualized by the immune system, and therefore you have a cancer in there. But at the same time, when you suddenly realize that actually you can do a revision of your situation, you suddenly come up with the clear idea that there is a crisis, and you change your perception. And like my brother-in-law that changed his perception that I am sick to, I'm not sick, I'm not going to need your services per se. And then immediately his body start reacting from the mind brain down, and it creating hope, anticipation, the realization that he is, or he or she is the person in charge. Again, the same attitude is going to create a limbic system that is going to influence the hypothalamic system, the pituitary system, connecting with the immune system, and the immune system is going to be geared toward solving the problem, eliminating all these cells, and the increased immune activity will eliminate the cells that are creating the problem, and these the production of abnormal cells is going to be decreased, and then there will be a cancer regression.
Sure.
All of this created by a strong mind that believe that it has the capability to solve the problem. And then it's logical that my role is to reinforce that.
Sure.
So that would be one of the first things that I do, clarifying to the patient that actually he is the healer, not the doctor.
Right.
And explaining that the doctor has an opinion, he has a different opinion, and between the two maybe are going to come up with the idea of there is a recovery thing. The doctor, of course, will help him with the things, especially nutrition. Nutrition is very important. The second idea that I would put on my client's mind is that the one that heals is him.
Right.
There's nothing wrong with the physician body. Meaning, at one point, I asked a physician regarding an operation that I was going to have in a hand, And I say, is it painful? No, he says, I'm not going to feel anything. No. So that was a joke on his part, but it's a clear, it is a clear message that actually the one that is going to suffer and the one that is going to heal is going to be me, not him. So therefore, I am in control of the body mind that has to do the whole thing. And the third and most important thing is that there is a connection between conflict and cancer. You solve the conflict and the immune system takes care of it. Happy people do fantastic things with their sicknesses. Sicknesses rarely attack happy people.
Right.
And therefore, my role is for my client to have full control of his mind, of his emotion, and on his ability to believe that he is in charge. It's a matter of gaining him or her the possibility or the opening for him or her to control or to have control of his or her mind, his or her life, his or her circumstances. There is a whole approach on that, which is a German new medicine, which is medicine aspect that is being demonized in the same way that cannabis was demonized for many years. And finally, to realize that in some studies of some research at the Jerusalem University, they discovered that we have another organ that they call it the endocannabinoid system that exists and obey to cannabis. So it's pretty tough. If you have an organ within your body mind that is sensitive to cannabis, then how could cannabis could be such a bad thing?
Sure.
So in this case, also information is very important to get control and to create a stronger belief on healing. Health and healing is something that the client does, not the doctor. The doctor or we as practitioners, we contribute to it, but the one that does it is the client.
Absolutely. Absolutely. So the idea of being in charge, not that you don't allow a practitioner to control certain perspectives or treatments or whatever, but that we maintain as the client that we're in charge of our own healing, and that's what's going to bring about a huge transformation as we go through it. So, well, Francisco, it seems as if we're just kind of scratching the surface of this giant topic.
That's right.
I really want to thank you for weighing in today and being willing to be my first guest on Healing Call of Cancer. This has been just delightful. Let me ask you, is your book available through Amazon?
Yes, it is. So you go to Amazon and you right at the top, at the very top, Francisco Valenzuela, PhD, and then the book will show up.
Will pop up. Oh, good.
Yeah, hopefully it's going to be very, very cheap by now.
Well, we know about royalties, and
oh yeah.
as authors, we're getting rich very slowly on our royalties. So it's always.
Well, did I show you my $19 royalty that I received this year?
No. Well, I got one the other day for $8.85. So there you go.
Aren't we important?
It's a humbling experience being a published author, but there we have it.
Well, which
Well,
means that we'll never be rich writing books anyways.
well, that's all right. We wrote them for a different reason, and we wrote them to serve. And so those of you viewing, go and get Francisco's book. I'll put, as I say, I'll put the title in the little descriptor below, and take charge, because if you're dealing with a cancer diagnosis, there's a lot of information for you to gather together, and it's important that you surround yourself with like-minded people who have a sense of positive outcome for you. And whether they're providing you energy, they're providing you prayers, it doesn't matter what the label is. If they're helping you in any way to support and uplift you, and then you get the help of professionals who know that you are the healer, that can make a difference. So you can do this because you're that magnificent, right?
That's right.
So Francisco, thank you for joining me. This has been just a pure delight, and we'll pick up. I have more questions that I didn't get through, but we'll pick up next time.
Anytime.
On the Healing Call of Cancer.
Yeah, will be a pleasure. Thank you for inviting me.
It's been an honor. Wonderful. All right, everyone, take good care. We'll see you next week on Healing Call of Cancer. And in the meantime, just have as much fun as you can and take good care. Bye for now.
Bye-bye.